Well, there's a new study out that says that the expansion of Medicaid under Obamacare will actually increase ER visits. Of course, the Obama administration repeatedly claiming that the health care law would actually reduce those costs. Because there are costly trips to the ER. Mark Siegel joins us. He is a Fox News medical A-teamer, a professor of medicine at NYU Langone Medical Center. So what's the deal here?
Well, first of all, the New York Times called this rigorous, and it was published in a journal, Science, which is one of the top scientific journals in the world. Now, a few years ago, PricewaterhouseCoopers already came up with this information that Medicaid patients were twice as likely to use the ER unnecessarily as people without insurance. This study confirms that. And again, this is a rigorously done study in Oregon. It involves Harvard University, and it showed that in 2008, when they gave more Medicaid to people, they were 40% more likely to use the ER, and many times, Greg, when they didn't need it. And I want people out there to know what an ER is actually like. We have 10% less ERs in the United States than we had 10 years ago. And when you go to the ER, if you're really sick, you do not want to see it clogged with people who have new insurance cards of any kind who don't need to be there. So that's the problem. Medicaid patients may not be able to get in to see primary care doctors like me. 20% of us do not take Medicaid. And even if I did take Medicaid, Greg, 50% of specialists don't take Medicaid. So I might not have the network I need. So you break a leg, I might tell you to go to the ER because I don't know an orthopedist that will work with you. Same thing with delivering a baby. Same thing with high cholesterol. No matter what your medical problem is, surgeons, no matter what your medical problem is, it's hard to find physicians that will work with you on the outpatient setting. You may be forced to go to the ER.
You know, the president repeatedly claimed that people had substandard Acme insurance, and he was going to replace that with his own version. But doctors I've talked to have said that Medicaid, and he's expanding the Medicaid rolls through Obamacare, that Medicaid is actually substandard because there are so many doctors who won't take it.
And not to mention hospital. Absolutely. That's absolutely right. Now, there's an advantage of Medicaid to people that have nothing. Studies show it makes them feel better. They have access. But what's never been done with Medicaid is to prevent overuse. And that's where the president was again being disingenuous, because we don't need our ERs filled unnecessarily with people who don't need to be there. And then the hospital suffers because the hospitals get paid a lot less for Medicaid. Medicaid restricts doctors more and hospitals more and pays us less. So it's not a panacea. And getting more people Medicaid, Obamacare, about half of Obamacare is actually Medicaid.
Right. I want to transition, if I can, to an AP story that I saw. And the headline is, adding a baby to health plan is not easy. Is that true?
Yeah, and that's not only true. That's a great story because it points out what's going on once the website is fixed. You fix the website, but all this effort was spent trying to fix the website. They didn't get around to things like figuring out a way to sign a baby up on the website. Great news, I have a baby, but I can't get the insurance to cover it.
Right.
Because the websites don't have that flexibility yet. So if someone dies, God forbid, or if there's a divorce, God forbid, or if a baby is born, great congratulations, you may not be able to get it added to the policy through the website. You have to go call your old broker. Remember those brokers, those dinosaurs? You got to call them up and say, what do I do now? Because I want my health care. I mean, a newborn infant needs health care.
Right. Quality and access, in your judgment and your experience as a doctor, going down.
Well, I wrote about this in the Wall Street Journal, Greg. I'm very concerned about quality going down because we doctors are already overwhelmed with transitioning to electronic health records. On top of that, dealing with people who think they have insurance and may not have insurance coming in January because of the website, it interferes with quality of care, and that's my biggest concern.
Yeah, you got a case of the for reals. You're the woman who takes care of all of your insurance took the week off, and you had to do it yourself. Everybody should read this in the Wall Street Journal. It's really an amazing story by Dr. Mark Siegel. Thanks, Doc.
Thanks, Greg.
Good to see you.